So just a minute. In detail, not required. Okay, so I'll take you, see this picture. In this lumbar plexus, so in this lumbar plexus we have L1, L2, L3, L4 and L5, isn't it? So these lumbar nerves, they are joining, and you are finding they are joining to form some nerves, network of nerves. So if you see the joining of L2, L3, L4, the posterior rami of L2, L3, L4, they are joining to form this nerve. What is the name of this nerve? Femoral nerve. This is the nerve which we are going to study in detail now, the femoral nerve. So this nerve is going and supplying the anterior compartment of the thigh. Okay, see, this is inguinal ligament. This is our femoral nerve, which is formed from the like lumbar plexus. It is running over the posterior abdominal wall muscles. Okay, so then it is passing behind the inguinal ligament. It is entering into the front of the thigh. When you see in the femoral triangle, we have vein structures medial to lateral, femoral vein, femoral artery, femoral nerve. So this femoral nerve will have one anterior division and one posterior division. Listen carefully. Anterior division is cutaneous. It has like medial and intermediate cutaneous nerves of the thigh. It gives like only one muscle, supply to only one muscle, that is sartorius. Anterior division gives nerve supply to only one muscle, that is sartorius. Rest of the two branches are cutaneous, supplying skin. What are the names? So I told you, medial cutaneous nerve of the thigh and intermediate cutaneous nerve of the thigh. Now, posterior division of femoral nerve is all muscular. Now there is a question for you all, like what are the muscles of the front of the thigh? What are they called as? Quadriceps femoris. Okay, so we have four muscles. We have vastus medialis, vastus lateralis, vastus intermedius, rectus femoris. So all these four muscles are supplied by posterior division of femoral nerve. One cutaneous nerve of the posterior division is saphenous nerve. Okay, so the same story will be written here, beta. Femoral nerve comes from lumbar plexus, L2, L3, L4. It descends lateral to the psoas major muscle, which you are finding in the abdomen. It enters behind the inguinal ligament, that is mid-inguinal point, midpoint. Okay, it passes lateral to the femoral artery, divides into anterior and posterior divisions. So muscular branches actually come from the posterior. Just now in the abdomen I said we have psoas major muscle, right? This is the psoas major muscle, which you can see originating from the lumbar vertebrae, and then you can see it is getting inserted into lesser trochanter. This is iliacus, iliopsoas. They are actually supplied by femoral nerve. Okay, so and we know it is also supplying the muscles of the anterior compartment of the thigh. Not only that, we also see the femoral nerve supplies pectineus. All muscles together we call them as quadriceps femoris. Okay, what are those? Vastus medialis, then vastus lateralis, rectus femoris. If you cut rectus femoris, below this we have vastus intermedius. Altogether, you call quadriceps femoris, and the sesamoid bone developed in the tendon of quadriceps femoris is patella. I'm repeating the point so many times. When you see the question paper, you will see as though I'm talking to you, and you will start writing, hopefully. See, cutaneous branches of femoral nerve, I told you, from posterior division, we have one cutaneous nerve, that is saphenous nerve. Okay? Suppose if femoral nerve is damaged, obviously all these muscles will not get nerve supply. So whatever function which is performed by these femoral nerve, they are all lost. So flexion of hip is gone. Then flexion and abduction of hip, which is produced due to sartorius, is gone. Flexion adduction of hip, which is brought about by pectineus, is no more. Quadriceps femoris, which is responsible for extension of knee, that is also no more. Okay. So femoral nerve injury, suppose if this nerve is injured, you will see motor manifestations. These muscles, quadriceps femoris muscles, will become waste. That means they will become thin. That's what is called as wasting of muscles, loss of extension of knee, Weak flexion of hip may be there because vas major is still intact. Okay, so that is all about femoral nerve. So once you are done with femoral nerve, what is the other question we have? Pericardium. Okay. What are these? Are only 3 marks questions, no? And this is already third link we are going with. Okay. So pericardium I will do tomorrow, but as a separate question. Or when any other question comes repeated, we will do this. So what are the branches of abdominal aorta? I'll tell you orally. We have inferior phrenic artery, we have superior suprarenal artery, we have renal arteries, then we have gonadal arteries. Okay, so and these are the paired arteries. Unpaired arteries are in midline. We have celiac trunk, we have superior mesenteric artery and inferior mesenteric artery. Lumbar arteries also will be there. Median sacral artery also is there. So these are the branches. Just see the list in your textbooks. Okay, these are the branches coming from abdominal aorta. Okay, and then development of diaphragm we will do when we are doing embryology. Then hallux valgus is the deviation of the big toe, which is on the medial side, as we see in gout. When we were doing some topic, I have shown you the picture also. Karyotyping. What is karyotyping? You can study karyotyping topic from Falcon Usmania or any SIA book what you have. At the end, genetics information is given. Karyotyping is nothing but it's a procedure. We generally collect the blood sample from the patient, okay, and we generally centrifuge the blood, and then we collect the WBCs, lymphocytes, and those lymphocytes we culture. We use some culture media to multiply those lymphocytes. Once those lymphocytes are multiplied, you will see you use the drug called as colchicine, which will stop the mitotic division at the spindle formation metaphase. Once the metaphase chromosomes are stopped at that particular phase of mitosis, what you will do, you will lyse those lymphocytes and you will just arrange the chromosomes on the slide, take the photograph and look under the microscope. Normal karyotyping, we have 23 pairs of chromosomes, but suppose if one chromosome is extra, as you see in Down syndrome, which chromosome? 21st trisomy. We have Patau syndrome, we have also Edwards syndrome, 13th and 18th chromosomes trisomy respectively. We also have other sex chromosomal disorders like Turner syndromes and Klinefelter syndrome. In case of Turner syndrome, one X chromosome will be less. In case of Klinefelter syndrome, one X chromosome will be extra. So all these clinical disorders can be diagnosed by making a karyogram, by doing this technique, karyotyping. Okay, every information is given in your, this is a very small topic which you will study and you will easily understand, hopefully. So after some time I will send the link for physiology. So I'm just stopping here. Okay, see you all after some.